someone comes in, there are a few questions I ask. One, are you done childbearing? And then two, I ask them, what's their day-to-day life? Are you able to take time off after surgery? Are you able to not lift something heavy for a few months while you're healing? So when a woman comes into my office and they're still childbearing or they don't have the ability to have surgery right now, we talk about conservative measures. Number one, physical therapy, and number two, pessaries. A pessary is made out of either silicone or rubber. It's a device that either looks like a ring with a little bit of a support structure in the middle, or oftentimes a ring with a connection with a stalk as well. We fit a person based on their, what their vagina has for measurements and what can actually keep the prolapse upwards. What this pessary does is, as it's in the vagina, it holds the prolapse up so they can go about their normal day without having the bulge fall down. For many women, it takes away some of the discomfort. However, for some women, the pessary itself is also a discomfort too.
Yeah, I can imagine how it impacts their intimacy as well,
Exactly.
sexual relationships.
Right. So that's the hard part about a pessary. There's different kinds. There are some kinds that women have a pretty easy time of removing, taking out, washing, putting it back in the morning for themselves. However, the more heavy-duty pessaries, especially one that we call a Gellhorn, that's the second most common type of pessary that we use. That kind is incredibly hard for someone to remove on their own. So if someone requires that kind of pessary, they're usually coming to the office every 3 to 4 months for us to remove it for them, clean it, and then put it back in. So when we're thinking about intimacy, right? So even the smaller pessary where someone's removing it themselves, there's a lot of planning involved. You're like, okay, intimacy is going to occur. I have to remove this pessary. I have to do all these other things to make sure I'm ready. And then the Gellhorn, though, brings another unique situation where some women may not be even able to remove that pessary themselves. And so that brings intimacy completely to a halt.